recorded, but when we start the Q&A, we're going to stop the video so that we can have folks come up on their screens and keep privacy issues. Okay. We're going to have folks hold their questions till the end of the presentation. And then it's up to you if you want to ask your question live on the video, or if you simply want to use the chat function to ask your question. That's up to you. All right. So with that out of the way, I would like to introduce Dr. Natalie Smith, who is a local psychologist. She has worked both in inpatient and outpatient programs. She's worked in school counseling centers, in mobile crisis and emergency services for hearing, hard of hearing, and deaf individuals. Natalie is also fluent in American Sign Language. So thank you, Natalie, for joining us today to work with us on our toolbox for coping with this isolation issue. Over to you.
Well, thank you for introducing me and for having me. I'm really excited. And for the purpose of this webinar, I'm going to refrain from not signing and let our wonderful interpreter do the translation if you do need a signer. And I also get so nervous about my screen from where I am freezing up. And I know the interpreter has a much more quicker and powerful internet than I do. So hi, I'm Natalie. My name sign is Natalie. And I am, for those of you who don't know me, I am hard of hearing. And without my hearing aids, I am completely deaf. And with hearing aids, I function with a person with a moderate hearing loss. And so I identify as hard of hearing. So I have a private practice in North Springfield. And like the rest of you and the rest of the world, I am in quarantine. So all of my sessions with my clients are essentially on telehealth, like what we're doing right now. And if anybody is interested in doing therapy or just talking or having a consultation or just needs to chat, you're always welcome to reach me. I'll be more than happy to spend a few minutes with you or whatever you need, because we all sort of need each other to get through this time. And so I am glad to be here, and I'm excited to show you some tools and ways to manage and cope during these difficult times. So in this pandemic, the stressors, we don't know them, the well-being of our loved ones is up in the air, and all of this that's happening in us and around us is leaving us all to feel pretty vulnerable, myself included. And you know, things in life happen and they're not always fair. We don't always have to understand how or why things are happening. But the thing to keep in mind is what we do with it. It's how we take care of ourselves during these times that are very difficult and stressful. So the news, you know, I have clients who tell me many times that they watch the news and they leave the TV on. And what I want to say about that is the news is constantly bombarding us with staggering statistics and horrible news in both the US and around the world. So it's easy to get lost in the news. The thing is I'm going to switch a little bit and talk about the brain. So the brain has this mechanism in it, and it's a mechanism that wants to protect us. And so when we are being bombarded with negativity and things that scare us, the brain kicks in and it becomes very hyper alert, and it scans things in the environment in order to keep us safe. So think of like the little Pac-Man for those of you who played it in the 80s. So the brain is on hyper alert to look and scan for anything in the environment that's threatening. And then it goes out into our environment, and like the Pac-Man, it goes around and it gobbles up things that will bring it back in and support and validate. See, that's not safe. See, that's scary. And it's really for the purpose of trying to keep us safe. And I'll explain even more about this in a minute. But for now, just know that the more you watch the news and saturate yourself with the negativity, the more your brain and your body internalize the bad, and it creates a more heightened sense of dread and fear. So it feels counterintuitive, but I want to know more information so I know what to do next. But what we're actually doing is solidifying and validating these things that bring us negativity. So focusing on the fear and the negativity can actually make us sicker, not better. So it's important for us to have a toolbox. And what I call it is an emotional and a mental toolbox. So like our regular toolbox for the house, where we store screwdrivers and hammers and nails for those days or moments when a light bulb needs replacing or a picture needs to be hung up. Think about a toolbox for your mental and emotional states. So with our house toolbox, we feel fairly confident in how to use our tools because we've used them before. But sometimes when we're filling up a toolbox for our mental and our emotional states, we're not really sure what kind of tools to fill them up with. So very few of us reach into our toolbox for a tool that we've never used before. And we certainly don't reach for we certainly don't reach for a toothbrush to fix a light bulb. So what do I mean by that? Well, in our stressful times, people often don't know how to handle unpleasant emotions in their bodies. They start to feel overwhelmed, vulnerable, angry, powerless, and so on. Some people start to reach for more food, maybe alcohol, or pornography, or shopping online, etc. These are the tools that are really not effective. Just like trying to change a light bulb with a toothbrush, grabbing for those Oreo cookies is not going to make the isolation go away. Or drinking that alcohol isn't going to make the fear go away. It's like the toothbrush. It's not going to fix the problem. So the mind doesn't know the difference between what's real and what's imagined. So for example, if I told you to imagine a very sour, ice-cold dill pickle, imagine drinking the juice, crunching on it, feeling the taste and the texture of this dill pickle in your mouth. And I don't know about you, but I start to salivate, like, that puckering in your mouth, just the thought of an ice cold dill pickle, or maybe even a lemon. When the brain imagines a place or a thing, an object, an experience, or a memory, and the body has a visceral response to it, the brain goes, oh, that's real. So again, there's that part of our brain who's looking to seek out that threatening stimuli to keep us safe. So during isolation, we don't want to find things in the environment that's going to scare us even more. We want to try and neutralize it. Yes, there's a virus. We're in a pandemic. Yes, we're isolating. But instead of focusing on the negativity, which makes us depressed and more anxious, what can we do? What are the tools in our toolbox can we grab for that will help us through this time? And something else I want to say about the part of our brain that tries to keep us safe so that it's hypervigilant to negative things that are around us, it's also called the primitive brain. And I won't say too much about that other than it's called the primitive brain because it goes all the way back to the caveman days, where caveman is standing at the door of his cave and he looks out into the world ahead of him with a spear in his hand and he says, okay, what might kill me today? What is a threat to my well-being? So his brain, in self-protection, goes into hyper alert to try and keep himself safe. So if you fast forward a gazillion years into today, what is threatening to my well-being is not necessarily a saber-toothed tiger. It's more of maybe like rejection, not feeling good enough. And now in the pandemic, we have the issue of isolation or feeling alone, anxiety, depression. So I'm here to tell you, give me 1 second. I realized I did not plug in my battery, and it's giving me a message that is low. So just give me a second here. I have one of those batteries that dies in like 5 minutes. Okay. Okay. So now I'm here to tell you that we are not our thoughts. And let me say that again. We are not our thoughts. We are an observer of our thoughts and our feelings. So just because we have a thought, I need ice cream, or, you know, that beer sounds good, it doesn't mean that we have to react to the thoughts. The ice cream isn't holding a gun to our head and it's threatening us. The mind will think ice cream. The body will respond. Usually it's a favorable response. And what happens is it triggers a craving. So a craving gets initiated. And when we have that mind and body connection, whether it's a positive or a negative, we tend to want to react. And in this situation with the ice cream, usually it's a favorable reaction. So we get motivated to want to go and get up and go get the ice cream. But just because we have the thought, I want ice cream, or we get a certain kind of feeling when we think of something, it doesn't mean that we have to respond or react. And this is actually going into why we have addictions and how to break them. And that I can talk about on a separate day because that's a different discussion altogether. So my point here is, how do we sit comfortably, or at least neutrally, with our thoughts and the feelings that come up in our bodies while we're in isolation? It's important to create the tools for your toolbox so that you can learn how to be in your body with all the thoughts and the feelings that are swirling about all day long. And you know, it reminds me of, if you think about Wall Street and all those ticker tapes are running by with all those numbers, our thoughts are like that. It's like the numbers that are just scrolling along that ticker tape all day long. And we learn how to grab for certain thoughts because we get used to them. Part of it is habit, part of it is learned conditioning, and it's learning how to note the thought, to be an observer, to step back, to be an observer of the thoughts. And just because we see some that are familiar, such as, I want ice cream, it doesn't mean we have to grab it. Or the ability to note that we grabbed it, but can we just let it go? So in terms of sitting in our body more comfortably and freely, I'm going to talk about 5 tools that I personally try and use on a daily basis. And they are mindfulness, meditation, breathing, journaling, and creativity. So why is it important to be connected into our bodies? First, if you think about it, you're the only person in this lifetime that you're never going to leave or lose. So why not learn to have a peaceful existence with the person or the soul or whomever you connect with that's in this physical body? You are so much more than just your physical body. So not only do we have our physical bodies, we have an emotional body, we have a mental body, and we also have a spiritual body. And I don't necessarily mean religion. Although if you are religious, you can connect into your spiritualness through your religion. And if you're not religious, you still have a spiritual body. And sometimes spiritual bodies can also be referred to as our energy bodies. We have energy. We are energy. So during these times of stress, learning how to be in our bodies can be of great relief. But if you're reaching for things outside of you to constantly try to make you feel better, like you're reaching for those ineffective tools in the toolbox, kind of like the toothbrush trying to fix a light bulb, if you're reaching for that food, you're reaching for the alcohol, unhealthy relationships, just for the sake of trying to fill yourself up, there lies the disconnect. Whether it's problematic behaviors or addictions, or you can't keep those or you're having difficulty grounding in your body, it's important to understand that if you're reaching outside yourself for something to fill you up, something like the food, the alcohol, that sort of thing, you're not going to feel grounded in your body. Because when we reach for things that are outside of us, that are mood altering, like alcohol and drugs and food, that automatically disconnects us. So you can't get grounded and feel that peace and serenity. But that's why addiction is so powerful, because the minute we do engage in something that's addicting to us, for a split second, it does feel better. But that's really what it really is the disconnect. So we want to learn how to feel more comfortable in our bodies. And I keep emphasizing that because it's so important to be comfortable in the body, because it is in our bodies where we hold and store the tools, and we learn to work with ourselves, and we learn to have peace, and we learn to be friends to ourselves, whether we're in isolation or not. And the more we learn to ground in our bodies, such as with mindfulness or mindfulness meditation and breathing, or mindfulness, mindfully engaging in something that's creative. And when we tap into creativity, it raises our vibration. One way to think about it is, the thing I'm getting ready to do, does it raise my vibration and make me feel better, or does it deplete me? When we learn to ground in our bodies, we feel less fear and other unpleasant feelings. Even though things around us might be difficult, we can learn to create peace and calm and have a safe space inside of us. So some of you might be wondering, well, what is mindfulness exactly? And many of you, I'm sure, know what mindfulness means. But just for the sake of this discussion today, I'll explain mindfulness as a practice of being very present in this moment. Mindfulness is the ability to be very present in this moment. And it's a practice because we have to practice being mindful. It's not something that just comes to us naturally. So here's an example of mindfulness. If I ask you not to move your eyes, but I want you to mindfully be aware that as you are looking at, your monitor, know that there's your peripheral vision. So if you look straight ahead and you mindfully become aware of things that are in your environment around you, but you're not moving your eyeballs, take a moment and do that. See what you mindfully notice that's around you, although you're familiar with your surroundings, and I understand that, but pretend you're not. So if you're looking straight ahead and you open your periphery, like for example, in my experience where I am, I can actually see a window over here to my left, or I can see a candle burning to my right, but I'm not moving my eyes. Those things were in my preview the whole time, but because I was not mindful, I was not aware of them. When I became mindful, my periphery expanded. So learning how to be mindful helps us to expand our inner and our outer worlds. So we're so used to being in our heads and our thoughts We think we're mindful, but we're really not. We mindlessly meander throughout our day, and we're not really thinking about what we're feeling or what we're doing. When we feel fear, anxiety, or depression, we tend to stay stuck in our heads or our thoughts. We focus on what's wrong, or we focus on the future, or we dwell in the past. And I'll say something more about that. So when we're truly mindful in this moment, we're present. So think of it like a timeline. So we're very mindful and present in this moment. There's two kinds of anxiety that generally happen. Oh, I need to put my hands down. I'm sorry. I don't mean to compete with the interpreter. Okay. So when we're here in the present, we're mindful. When we go into the past and we start to ruminate or obsess or think about things we cannot change, because in the past something has already happened, so we can't change it. But here's the secret. We're not supposed to want to change it. Something has already happened. So when we dwell and ruminate over something in the past, we tend to get stuck and we get depressed, but we're not present. So one thing we can do is make note and become mindful. Oops, I got stuck in the past. Come back to this moment with a breath. The other type of anxiety that can happen is we jump into what I call the wreckage of our future. What if I can't go to work tomorrow? What if something bad happens? What if, my friends or the people I love get the coronavirus? What if? So what's happening is we are manifesting this negative story that's in the future that has not happened yet. And like I said earlier, our mind doesn't know the difference between what's real and what's imagined. So if I'm obsessing about something in the future, so I'm having the thought, and then I have this visceral reaction to it, so I start to get panicked and anxious, my brain is going, that's real. But if you stop and think about it, no, it's not. What we worry about in the future is something that we generate and make up, and how important it is to remember that. So I do it too. For example, this virus is very scary. So another way of saying it grounding in my body, I feel scared when I think about the virus impacting or hurting the people around me that I love, and how powerless I feel in being able to stop it. So I can acknowledge my feelings. I can acknowledge the experience that I have. I can mindfully be very careful not to jump into the future and go, but what if it kills the people I love? What if? And then I'll start getting a panic attack because all of that was made up. I don't even know what's going to happen 5 minutes from now. And that's my ability to mindfully keep myself very present in this moment. And sometimes I do it very well, and sometimes I slip. And what happens when I slip is I start to feel really anxious. And then I can stop myself and say, why am I so anxious? Oh my goodness, I've just been spending all this time thinking about something in the future. Okay, note it. I'm not going to beat myself up for it. Can I just take a deep breath? And can I just come back to this moment? In this moment, what I'm worried about is not happening. In this moment, I'm okay. I'm in my body. I'm right here. And we have to practice. I will speak for myself. I have to practice that a lot because it doesn't take much before my mind starts to go. Remember, my mind is always trying to keep myself safe. So it's always on hyper alert, looking for that saber-toothed tiger out there that's going to kill me. And we have to practice over and over again, coming back to this moment. So what I want to teach you and how to do that is breathing and meditation. So the next tool is breathing. So of course we breathe, or we wouldn't be alive. So how is that a tool? There is a difference between breathing for the sake of staying alive. And thankfully, your body knows how to do this without you thinking about it. Mindful deep breathing, where you intentionally think about your breath, is a little bit different. That is otherwise known as conscious breathing. What is effective about this is that when we shift to a mindful, aware, deeper, slower, and purposeful breathing, it automatically turns down the nervous system. So that's pretty cool. I'll say that again. When we become aware of deep breathing and allowing our body to take in deep breath, it automatically turns down the nervous system. Because what's happening is, as we're getting anxious, our breathing becomes much more shallow and our bodies are getting deprived of oxygen. So when we mindfully say, okay, mind, you're going to go down into the body, and how are you going to do that? You're going to take in very deep breaths right now. And when you take in very deep breaths of oxygen, you're replenishing all the cells. So when all the cells in the body get oxygenated, the nervous system can then slow down. Another way of saying this is when we get anxious, the body's not getting enough oxygen. So the anxiety is telling the body, hey, we need more oxygen. So what do we need to do? We need to stop what we're doing and take some deep breaths. It doesn't mean that the problems are going to go away. But when we focus on mindful breathing and deep breathing, we can slow down and get calmer in our bodies. So one way to mindfully breathe is to, I'm going to just show you for a second how I do it. So it starts with 3 deep breaths. And what you do is you imagine, you don't have to imagine this, but it's helpful if you are somebody who likes to visualize. So put your hand on your belly. You can't see me doing it, but just put a hand on your belly and imagine that there's a balloon inside your belly. Maybe it has a color, say an orange balloon. And it's deflated and it's sitting inside your belly. So when you're breathing in through your nose, and I'm going to demonstrate this and then I'm going to have you do it. So when you're breathing in through your nose, you keep your hand on your belly. In fact, let me see if I can turn this down a little bit so you can see me. Not very well, but I'll step back a little bit. So when you're breathing through your nose and you take in that breath, I want you to imagine like you're bypassing the lungs and you're taking that breath down into the belly. And as the deeper you breathe in, the more you're expanding the balloon. So by the time you take all your breath in, the balloon is completely expanded. And then you hold the breath for about 2 or 3 seconds, whatever you're comfortable with. So the balloon is full. And then you breathe and release through your mouth. And then as you're breathing and releasing through your mouth, the balloon is slowly coming back because the breath leaves your mouth and the balloon gets smaller. So as you keep your hands on your belly and you breathe out, you will know, I'm going to scoot in a little bit more now, you will know when the breath has left your belly because there's no more to breathe out. You're ready to breathe in again. So you do the same thing. You take in another deep breath through your nose. You hold it, and then you breathe out. So for those of you who are watching this, let's see if we can do this together. And if you have any questions about it, just feel free to ask me at the end. So let's start. We're going to do this 3 times. One hand on your belly, or not. Imagine the balloon and take in a breath, like about 4 seconds worth. Hold and release through your mouth. And you feel the balloon empty. a trick here, don't get lightheaded. If you get lightheaded, you're doing it too hard, too fast. This is supposed to be comfortable and natural. And the reason why I didn't, well, I said count to 4, but you're going to count whatever is comfortable for you. So let's take in another, I'm sure you were breathing again while I was talking, and I apologize for that. So let's go back to the breath. Take in a deep breath and hold and release. One more time. Take a deep breath through your nose, down into the belly. Hold for a few seconds and release all the air out of the balloon. And now just go back to a normal state of comfortable breathing, just in and out. And I don't know about you, but I feel calmer just doing that exercise. And that's what I would want for you. So for those of you who had success, great. For those who didn't, or you have questions, hold them and we'll talk at the end. So the next thing I want you to do is experience what it's like to have a mindful breathing and meditation. And we're going to do this all at once. So what I invite you to do now is to find a comfortable position. Hopefully you've been comfortable sitting there during this talk. But now I want you to have a mindful sit or a mindful meditation. And right now I happen to be sitting in my meditation room in my house on a zabuton cushion, which I will show you. There's different ways you can get comfortable. So this is a meditation cushion, and I use this because it's comfortable for me. But you can use anything you want, such as a chair. I don't encourage you to lay down unless you have an injury, because the problem with lying down while you're meditating is you get so relaxed, which is the goal. But when we're lying down, sometimes it clicks over in our brain, oh, we're lying down and we're relaxed, let's go to sleep. And that's not what you want. In mindfulness meditation, you ultimately want to have a very alert, relaxed state. But alert is the key. You don't want to fall asleep. For those of you who do yoga, you can also use a yoga block. You can use pillows. You can do whatever you need to do. But worst case scenario, a chair is fine. In fact, there are days when my body, because I'm at a certain age where gravity takes a toll and I have some old injuries. Sometimes when I meditate, I just go sit in a chair. Other days I sit on the cushion. Other days I go sit outside, whatever's comfortable. So find a comfortable position. And now set the intention. When I say set the intention, it's an invitation to you to be mindful, to sit quietly for the next couple of minutes and bring your attention to the natural rhythm of your own breath. For those of you who can hear my voice and you wish to close your eyes, that's fine. For those of you who would like to read the captioning or watch me or observe the interpreter, whatever is comfortable for you so that you're getting the information. Set the intention to allow your body to feel comfortable. And if your eyes are open so that you can take in information, invite your eyes to go into more of a comfortable, relaxed state so that you're taking in the information, but you're inviting your body to be relaxed and comfortable. Focusing again on the natural rhythm of your own breath, in and out. Feeling the raw sensation of your body as it makes contact with the supporting surface. Note the heaviness or the weight of your bottom against the cushion or a chair. Maybe there's some temperature change. Maybe there's heaviness or warmth. The solidness of your body in contact with whatever you may be sitting on. Continuing to just breathe in and out. Note the gentle rising and falling of your chest. Feeling so relaxed and so comfortable in this mindful, relaxed, and alert state that if someone were to see you right now, and if your eyes are closed, they might mistaken you for sleeping. And yet, you're relaxed. If you need to scratch or itch, note the need to scratch or itch. If there's an itch on your nose, you might say to yourself, oh, I'm noticing the itch on my nose. What is it like for me to sit here with this itch on my nose? We're so quick to want to just take our finger up to our nose and scratch it and then take it back down. What if I can note the scratch, or I can note the itch? And can I tolerate this itch? Maybe if I just sit with this itch, maybe it'll go away on its own. Maybe I can just will it to go away. And just being able to be with the different sensations in our body. Some of the sensations are pleasant. Some of the sensations may be unpleasant. Maybe they're just neutral. It's just an itch. Can I just be with it? Some of us might be experiencing some discomfort as we're sitting quietly and calmly. If, let's say, there's back pain or a lower back discomfort, do I note or can I note this discomfort that's in my lower back or the discomfort that's in my knee? And as I'm sitting here comfortably and relaxed, can I just let this discomfort just be there with me right now? Can I just neutralize it? Perhaps I can breathe into the discomfort, or I can visualize a warm light with my breath, and with a laser beam, I can evaporate the discomfort so that it can allow me to just experience a state of neutrality in this moment. The mind is very powerful. It can do many things. And mindfulness and meditation and breathing can help us to create a more connecting relationship with the mind and the body. And as I'm becoming much more aware of the sensations in my body and my mind right now, what else might be present? Perhaps a fluttering in my stomach because of anxiety, or perhaps there's tense muscles in my jaw. And if my jaw is tense right now, relax it. Allow the jaw to completely relax. Where's the tongue right now? Is the tongue at the top of my mouth because I'm tense? What would it be like for me to just relax my tongue right now? Allow it to just fall back into the back of my mouth and relax. And while continuing to breathe in and out, comfortably and naturally, sense the stillness or the openness that is also present in the parts of my mind, of my body, my heart space, even in the midst of sadness and stress. Perhaps I am noting feelings that are unpleasant. Perhaps I'm noting sadness. Where might sadness be in my body? Do I hold it in my stomach? Is it sitting heavily on my chest? It's just a feeling. can I just be with it right now? I don't have to make it go away. I don't have to push it away. Can I just note it and be with it? Continuing to allow myself to breathe comfortably and naturally. Perhaps a sense of aliveness flows within me. I feel relaxed. I feel centered. I can feel tingling, or I can feel different parts of me connecting in right now. And as my breath comes in, I can imagine myself receiving life energy. And as I breathe out, I can imagine anything toxic or stressful or unpleasant leaving my body. I can be open to the idea that I can have total acceptance and be receptive to whatever is in this experience right now, whether it's pleasant, unpleasant, or neutral. And now, take one more deep breath into your body. And as you breathe out, if your eyes are closed, gently open your eyes to full awareness so that you're fully alert and back in this room. And if your eyes are already open, then allow yourself to be fully aware that you are here now and back in this room, listening to me with full alertness. And just take a moment, and if you participated in that and you had any kind of sensation or experience, whatever they may be, it's not right or wrong, it just is. You know, the Buddha talks about the three feeling states, that there's pleasant, there's pleasant, neutral, and unpleasant. And that there's no right or wrong feeling, they're just feelings. Our mind, our brain wants to categorize the feelings. Those are good feelings, those are bad feelings. You know, in my office, I have a stack of feeling cards, and I love playing the card game with people. And what I often do is say, okay, here's a stack of cards, and these are feeling cards. I want you to sort them in piles that make sense to you. And yes, most people will put a good pile and a bad pile. And sometimes there's more piles. But that's the brain compartmentalizing the feelings, the good feelings, the bad feelings. So I'm going to experience and allow for the good feelings. But if the bad feelings come up, I'm going to push them away. So part of being mindful and learning how to meditate and breathe and be more comfortable in your body and not reach for something that's outside of us, like alcohol and food and all those non-healthy behaviors when they're taken to an extreme. If we want to feel the feelings, even the bad ones, because they're not really bad, they're just feelings. They're trying to tell us something. And the more we learn how to work with the feelings and in our bodies, the more we can manage whatever is going on around us that's uncomfortable, such as a virus. And isolation. So the last two things I wanted to talk about, and we'll stop, is journaling and creativity. So I know a lot of us don't like to write, especially, it's not a thing, but I'm not talking about writing. I'm not like in English, like you're in an English class and you have to write a paper on something. I'm talking about, this is my journal, I'm talking about journaling. And what I mean by journaling is getting a piece of paper or buying yourself a cheap little book. And anytime you're having feelings, just write feeling. Fear. I'm going to write fear. And you can do a couple of things with it. If you're scared to write or nothing comes to mind, you can do, and this is fun, you can do what's called free association. So you can set a timer for, like, say, 2 minutes or 1 minute or 30 seconds. It doesn't matter. And put your pen to paper, and for the 30 seconds until the timer goes off, you're just going to write. And it may go something like this. I have to write. I have no idea what I'm going to say. This doesn't make sense. This is silly. I was supposed to write on fear. Oh, I'm fearful that I don't know what I'm fearful of. This is so silly, 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 silly. And the next thing you know, ding, 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 the timer goes off. That's free association. It doesn't matter what you write or the grammar. No one is going to see this but you. But if you have a hard time writing and you have a hard time opening up, the free association writing is often a good exercise. The reason why I enjoy journaling, whether you doodle in it, whether you write in it, whether you write in it with an intention, with a question, whether you title a piece of paper with a feeling or whatever you want. What's really wonderful about journaling is because our minds are so busy and because our heart space holds so much feeling, there's something magical about taking this and having it come through this arm and putting it on the paper. And kind of like meditation and breathing, what it does is it quiets the mind, because once we get it on paper and we see it on paper, the mind goes, oh, it's written down, so I won't forget it. So then the mind can quiet down. When the heart space is feeling all these feelings and getting so fluttered, when it sees it on paper, it can quiet down. So journaling is a nice way to get the mind and the body to quiet down, and it will hold it for you in the journal, so it frees up your space to think about other things. And the last thing I want to talk about is creativity. In fact, while we were waiting for the conferencing to go on, to get started, because NVRC does an awesome job setting us up so that we can have this today, just to quench my own anxiety about, am I going to say things right? Am I going to remember everything? I brought my knitting. Knitting is a wonderful creative way to raise my vibration, to help me to feel better, and to lower the anxiety. And creativity can show up in so many different ways, whether it's going outside and gardening, whether it's drawing, coloring, knitting. Go on YouTube and learn how to do something you've always wanted to do. It doesn't matter if you're an expert in it or not. We have a left side of our brain, which is very cerebral and logic and sequential and likes to problem solve. And then we have this right side of our brain that just loves creativity. And for those of us who are already in the right side, like, the artists or the musicians, or people who have hobbies, that's great. Keep doing it, because we need balance. And when we get into isolation and we start to feel anxious and depressed, we feel less motivated to tap into the creative sides of us. But it's not good enough. But it's not good enough. But it's not good enough. And it doesn't matter. Nobody's here to judge or critique. It's all about self-care and self-preservation. And what is it that I can do that will help me to feel a little bit better in this moment? So being able to find something, some kind of creative avenue, an adult coloring book, anything, and keep it simple. Don't try and complicate it, and try not to judge and criticize. That's the other thing about mindfulness, and I'll stop. Part of the mindfulness practice is the ability to be mindful in this moment. So if I'm sitting here meditating, and let's say my mind is just so busy and I'm having a really hard time following my thoughts, instead of sitting there in my mind going, God, I can't do this. I can't get my breath. My thoughts won't stop. It's, can I just note, oh, busy mind, and just bring myself back to the breath. Let's breathe in and out. Let's breathe in and out. And I get myself back to a quieter place. But guess what? While I'm meditating, my mind goes back to busy. It goes back to busy. It's judging. What am I going to eat for dinner tonight? And then I notice, oh, I'm thinking again. Thinking. Yes, the mind thinks. The mind is wired to think. Meditation isn't about trying to control the mind. It's about learning mindfulness meditation. It's about learning how to be with our thoughts in that moment. And if we notice that we go down a rabbit hole of nothingness and that our minds jump into an orbit of thinking, gently bringing ourselves back to a place of presence and taking that breath and starting again. That's the mindfulness. and the ability to do it without judging or criticizing ourselves. It's just like training a puppy. You know, you're trying to train a puppy not to urinate in the house, and you're bringing it back and bringing it back. And the minute you show frustration or anger at the puppy, it just shuts down because it doesn't understand why your energy shifted. We do that to ourselves. And again, that's another talk, another day. I call it the inner critic. In mindfulness, the practice is the ability to be present in the now without judging and criticizing yourself. So when you find yourself practicing your breathing, you find yourself journaling or doing something creative or sitting in a meditation, try not to judge and criticize yourself. So that's about it. I hope that this was helpful, and I will be happy to answer any questions that people have. I'm going to stop here. I'm not sure what to do next other than somebody's going to take over.
Thank you so much, Natalie. That was a lot of really great information. And since we've all been sitting here for a while, what I'm going to do is have us do just a 2-minute break. Folks can get some water, get up and stretch, take some nice deep breaths. And then afterwards, after that 2 minutes, we'll be back for the question and answers, okay? So thank you again, Natalie, for joining us today. And we look forward to the question and answer session.
Okay.
All right, we're going to go ahead and start our 2-minute break. Thank you.